happen to have a son and a sister and several friends who are social workers. And I like to tell them about Woody Allen's version of social workers. He says he wakes up in a sweat with this terrible nightmare and he's being stalked by a 10-foot body of a spider in the head of a social worker. Anyways. Now, a couple of weeks ago I met with Jean and David to kind of focus my talk, and they said that really I could cover pretty much what I've covered in the last 2 times I've presented at this rally. And I thought, well, that's easy, I'm busy, I could certainly dust off those talks. But it just didn't feel right. It didn't feel right at this time. And I guess it goes along with that saying that if you keep doing what you've always done, you'll keep getting what you've always got. So I thought I would try something a little bit different. I certainly could tell you about the explosion in the diagnosis of autism. Mel is right, it's gone from 4, I think, in 10,000 up to 1 in 68. And we do have current BC statistics, by the way, that are 1 in 69, so we're right on par with the US statistics. I could also tell you about the lifetime costs of autism. I like to go on about that because autism treatment is expensive, but it's way more expensive not to treat. And when we look at the studies that have looked at the cost, lifetime costs of autism, what we see is it's about $1.5 million if a young person doesn't have an intellectual disability, and can be over $3 million if they do. So the costs of not treating are astronomical. I could also tell you that in this year, the National Autism Center in the US redid their National Standards Report, which is a brilliant review of the state of science for autism treatment. And once again, they've indicated that behavioral interventions represent over 90% of the scientifically validated studies in autism treatment. So when people tell you that there's many different ways to treat autism, that's not really true. That 90% of the most validated studies really fall in this one area. And that study actually reviewed 39 different approaches. I could also tell you that because I'm a professional advisor to autism organizations, I try to keep up on the autism literature. And Google Scholar Alerts drops about 20 studies every week in my inbox. About half of them are treatment studies, and nearly all of them are reporting positive treatment outcomes. This is a very, very treatable condition. Now, you notice how I snuck in that information anyways, even though I wasn't going to tell you about it, right? But I would like to try to do something different. And what I decided to do was look to psychology for a bit of inspiration about what to do today. And one of the things we do in psychology, when someone comes to us with a problem, one of the first things we do is we look at whether it's a problem knowing what to do or a problem doing what you know. If it's a problem knowing what to do, then we're giving information, we're trying to increase insight, we're teaching skills, and so on. If it's a problem doing what you know, if you know what to do and you're not doing it, then it's a motivational problem. There might be the rewards or consequences are not big enough to move you. There might be a belief or fear that holds you back, but we're talking about a motivational issue. So then the question is, how do we motivate? How do we get going? Now, to cope with difficult situations, human beings have this little process that we call downward comparison, the silver lining argument. And what we do in difficult situations is we start to say little things to ourselves like, perhaps if we lose a loved one, well, at least he didn't suffer, right? Or we have a car accident and we say, well, no one was physically hurt, thank goodness. Or we look around the province of British Columbia and we see that other children with disabilities have even less support than the children with autism. and we are thankful for what we have. Downward comparison is useful to help us cope with what we have, but it's not helpful at all to help us fight for what we need. And so let's turn it around. Let's try a little upward comparison. Let's start with Italy. Okay? I just went to Italy. Beautiful country. Chaotic country. Since the Second World War, Italy has changed governments about as often as we change clothes. And during that time, the Italian economy has been in disarray essentially through that whole 60-year period. And in spite of that, in Italy, they've developed a sensible child care policy, child care for typically developing kids, and a sensible policy of supporting children with special needs. The Italians have done that during a terrible time in comparison to Canada. And they did that because it was important enough to them to take good care of the children. Now, I do think they've fallen behind in their helicopter fleet. Let's look at cancer treatment. Mel mentioned that in medicine, if a youngster has cancer, the treatment is immediate. Now, I'm not suggesting that we would trade any of our kids for a child with cancer, but I think it's important to look at how cancer treatment unfolds. If a cancer is suspected, the assessment and diagnosis occur without delay. Best practice medical treatments are in place within days or weeks at the very latest. And the child receives as much treatment as they need. And this occurs wherever you are in Canada. And there's no extra cost to the families. That's how Medicare should operate. Now, imagine the outrage that would happen among parents with children with cancer if they got the kind of treatment that our children with autism receive. Imagine that you're referred to the Provincial Cancer Assessment Network and you wait 6 months, 12 months, 18 months for a multidisciplinary diagnosis. And then, instead of getting treatment right away, you're directed to an organization that maintains a list of approved cancer providers for the province. And then you go home and you contact a bunch of these cancer providers and you invite them to your home and you interview them and you pick your oncologist, okay? And then you and the oncologist train a bunch of university students to provide the cancer treatment to your child, okay? Then, when you hit your $6,000 limit or your $22,000 limit, you then have a very difficult decision. Do I stop treatment and hope for the best, hope the cancer doesn't come back? Or do I proceed with treatment, take a second job, sell my house, and go down that way? The point being is what's unacceptable for cancer should be unacceptable for autism.
Right. Yes.
Why isn't it? Third little example, upward comparison, okay? My favorite description of the relationship between Canada and the US comes from the late great comedian Robin Williams. Some of you may have heard this. He said that Canada is like living in a loft apartment above a really great party. A few years later, he was interviewed about Canada. He was in Canada at the time. And he said that Canada is the kindest country in the world. And then he continued, it's like living in a really nice apartment above a meth lab. Okay. So for our upward comparison, let's look to the United States and let's look to one state in particular. Pick it at random. How about Wisconsin? All right. Wisconsin's not the financial hub of the US. It lands about middle in terms of average income for the states. One of its major exports is cheese, and it has a lot of farmers. There's nothing special about Wisconsin. Now, one of the things about Wisconsin is that they have this bizarre belief that autism is a medical condition. You know, farmers, what do they know? All of the autism treatment programs, and in fact all of the healthcare programs for children with disabilities falls within the Wisconsin Department of Health Services. In Wisconsin, they have an aggressive child find policy. And by that, what they do is they spend a lot of time and energy and resources training primary care physicians, public health nurses, daycare operators, preschool teachers, and so on to identify the signs of a developmental disability, including autism. And they try to abide by a commitment to move from identification to assessment within 1 month. In Wisconsin, they have a birth to 3 program that all children with disabilities are eligible for. Kids with autism and all other kinds of disabilities. It's federally mandated under the Individuals with Disabilities Education Act, or IDEA, in the US. And the costs of that program are supported by federal funds, state funds, county funds, private insurance companies, and sometimes by co-pay with parents. But usually that's a nominal amount. And all children get birth to 3 quality early intervention contact. In addition to that, our farmers in Wisconsin also have an autism program. And the autism program entitles all children diagnosed with autism in Wisconsin to receive 3 years minimum of 30 to 40 hours a week of ABA therapy, or intensive behavioral intervention. At the end of that time, if their needs are still high, they can continue in that same program, or they can move into other programs of support, all of which are more generous than our program here in BC. And here's the kicker. In July 2014, the federal government issued a guideline requiring all states to provide autism treatment as part of their statewide Medicaid benefit. All states. The start date in Wisconsin is one of the earliest in the US. It's January 2016. It's 6 months from now. So let's take a look at this. Our free enterprise neighbors to the south have moved towards medical coverage for all of their citizens during one of the worst economic crises that we've seen in recent times. And they've embedded autism treatment in their program. Autism treatment is in their version of Medicare. Now, the question is, if farmers in a meth lab can do it, why can't the kindest country in the world, with the longest history of Medicare, also do this? Why not? When Jean and Sabrina talked to me about autism and Medicare 20 some odd years ago, I thought, good for you, kind of far-fetched. I don't know if it'll happen. It's no longer far-fetched, not at all. It really is within our grasp. I'm not going to talk specifically about what you can do individually to push us over the reality. I think there are others today that will speak to that. But I think that elections are interesting times because they're one of the few times where the tail can wag the dog, a small group of dedicated citizens can really make a difference. So